So the Innovation Exchange leadership is all about looking at different countries and what infrastructure we've got set up to put fabulous research and innovation into practice, and how we spread and sustain that innovation when it's in clinical practice or working with patients to make their lives better. So we've been talking about the infrastructure we have in our countries to do that. In the UK, we've talked about our funding into the National Institute of Health Research, where we fund clinical time and we fund research studies. We've also talked about universities, and our research has to be about impact. Does it make an impact on the ground for those patients and people that we serve? Academic health science networks are the bodies that put innovation into practice. We pick up great innovations, develop them, and then we help the NHS, frontline clinicians, patients, relatives to spread and adopt those innovations. And we also keep a track on them to make sure that they sustain, and if they don't, we'll go back in and support them to sustain innovations. So we've got an ecosystem set up between industry, the NHS, and our local academic partners to make sure that we adopt and spread innovation and sustain it. An example about how we've been spreading innovation across the AHSN network is our campaign to reduce strokes due to atrial fibrillation. We have a campaign that's about detecting atrial fibrillation using digital devices, correcting it using the correct medication with GPs and supporting GPs to educate each other about what that is, and then also working to protect that population to make sure that they sustain medication and that they keep healthy and don't have a stroke. So since we got involved, the numbers of atrial fibrillation related strokes have decreased, and we're monitoring that over time to make sure that we sustain adoption into practice. So from the Innovation Exchange, we've learnt that we're all grappling with similar problems. We all have issues with adoption and spread of innovation, releasing clinical and staff time to concentrate on spreading innovation, and also to maximising the benefits by sustaining innovation. So we've heard some great examples of clinicians being given protected time, of networks working together to make sure that innovation is spread more widely, and also of how we can work across boundaries to make sure that we sustain innovations between ourselves and monitor them to make sure that we have great patient and citizen outcomes.